So minimally invasive glaucoma surgery, or MIGS procedures, have been developed over recent years to reduce some of the complications and time required compared to normal standard glaucoma surgery. Standard glaucoma surgery is very effective, but can be quite invasive and require a lot of follow-up. So it takes a lot of patient time and surgeon time to be carried out. They also have a slightly higher complication rate. So MIGS procedures work by using microscopic equipment and tiny incisions with small devices inserted into the eye to increase the drainage and lower the pressure. While they reduce the incidence of complications, some degree of efficacy is traded off for the increased safety. So they're usually used in mild to moderate cases of glaucoma. The MIGS group of operations can be divided into different categories. They're sort of miniaturized versions of a trabeculectomy, which is the standard glaucoma procedure. And this is usually small microscopic sized tubes inserted into the eye that drain fluid from the inside of the eye to outside underneath the outer membrane of the eye, known as the conjunctiva. Examples of this include the Zen implant and the PreserFlow implant. The other forms of MIGS surgery are trabecular bypass operations. The pressure is raised in the eye because there is a problem with the drainage system in the eye, known as the trabecular meshwork. And this is like a sieve-like structure within the eye. By bypassing this, these surgeries aim to lower the pressure. And this is usually small devices that are inserted into the trabecular meshwork to bypass it without damaging any other structures, but allowing for fluid to pass through them. And these include the iStent, Hydrus, Omni, and Trabectome. So MIGS procedures, though are not as definitive as the more invasive surgery like trabeculectomy, which has a success rate of about 80% and lowers the pressure further, but has more complications. MIGS success rates are lower and they are less effective at lowering the pressure to a very low level. However, because they are less interventional, they have less complications. And so there's a balance between the invasiveness of the procedure, which is less in MIGS procedures, the effectiveness and the safety. So MIGS procedures are usually used in mild to moderate glaucoma. Your glaucoma specialist would be able to advise you if you require a very low intraocular pressure or have very advanced glaucoma. They're probably not the procedures for you. However, if you have mild to moderate glaucoma and want to come off your drops, for example, or reduce the number of drops, these procedures are quite effective at doing that. They also can be combined with cataract surgery. So at the time of cataract surgery, a MIGS procedure can be carried out to bring a patient off drops. The safety with the surgery is relatively good compared to the more invasive major glaucoma surgeries. And as I've said before, however, it may not be as effective at lowering the pressure. If you have mild to moderate glaucoma, you may not need to have your pressure as low, so it can bring you off the drops in a relatively safe, controlled manner. As I have said, it is a very safe procedure, but no procedure is without risks. The risks with MIGS procedures is usually infrequent and temporary. So there can be bleeding involved when the devices are inserted. However, this usually resolves within days. Sometimes the pressure goes up, so the patient gets an intraocular pressure spike. But again, this can be treated and only lasts a few hours to days, but will come down quite easily. Rarely you can have damage to the cornea, the window of the eye, or the iris, the coloured part of the eye. But these are very rare complications. And these are the usual complications with MIGS procedures, particularly those that are trabecular bypass procedures. With those miniature trabeculectomy type procedures, the Zen or the PreserFlow, you can get leaks from the conjunctiva, the membrane around the eye that the tube has been placed under, and that can be an infection risk. But these are very rare. And sometimes with those procedures, the pressure can be too low. But again, this is a transient thing, and the pressure usually stabilizes within a few days.